My name is Dr. Louise Crowley. I'm the host for the webinar today, and I'm an academic clinical lecturer in respiratory medicine from the University of Birmingham. I'm very excited to be hosting it today, which is entitled Artificial Intelligence in Health Research, Augmentation or Abdication. We're very lucky to have Dr. Joseph Alderman here, who's an NIHR academic clinical lecturer in anaesthetics from the University of Birmingham. Welcome, Joe, and thank you for joining us. Before you start, just a little introduction about Joe. So Joe graduated in 2015 with a Bachelor of Medicine and Surgery from the University of Birmingham after he had completed an intercalation degree in virology. This is where he found his love of science. Joe spent his early academic career interested in immunometabolism, in particular the role of blood lactate in critical illness. For example, looking into why is it that sick people get a high blood lactate? Is this adaptive, maladaptive, or is lactate simply a bystander? Joe quickly realised that whilst he found it interesting, lab science was not for him. He therefore pivoted to artificial intelligence and digital health research in 2022 for his PhD. Now, as a postdoctoral researcher and NIHR clinical lecturer, he has triangulated research, policy, and practice to help bring useful digital technologies into practice while protecting patients and the public from harm. Today, Joe will help us gain an understanding of the potential prospects and pitfalls of artificial intelligence and health research. Welcome, Joe, and over to you.
Thank you so much, Louise. It's really great to be here this afternoon. Thank you so much for the invitation. I'm going to seamlessly start sharing my screen. I've deliberately chosen this provocative title, AI in Health Research, Augmentation or Abdication. And I'm going to spend the next kind of few moments talking through the many ways in which AI can be undeniably helpful for us as researchers, us as clinicians, but also I think some of the pitfalls we need to be aware of to make rational, sensible choices about how to deploy this powerful technology into our research and into our practice lives. But I'm a big believer in getting to the main point quickly, because I know that this is the post-lunch slot, or maybe you're actually eating your lunch right now, and that many of you might be coming to this presentation afterwards in a recording. So if you only take away 3 main points from my talk today, here's what I'd love to walk away with. Well, first up, to acknowledge that AI is undeniably enormously powerful and has many uses for us in healthcare research. But as I mentioned previously, there are pitfalls, and we all need to be mindful of these. And these include hallucinations, where models can make stuff up which isn't true, impairments in the way that we think as professionals and as researchers, interactions with our ability to cognitively think through problems and to develop new understanding of things, considerations around data privacy. Any input we put into the model might be used for model training, might be leaked. And also challenges that I think are a bit under-recognised at the moment about what this means for the world of academia. What does academic integrity mean when we know our students and our researchers can quickly generate content using large language models? And my personal belief, to close off this bottom line up front, that we need to maintain transparency, accountability, and critically human oversight when we use these technologies. But getting into it, look, some numbers to kind of demonstrate why this matters. Well, look, this survey is now at least a year out of date, but from a survey from Oxford University Press a little while back, more than 2/3 of researchers who responded are already using AI in their research. And I put it to you that number is probably even higher nowadays. And that usage might be quite extensive usage. For some people, it might be only limited usage for others. But nonetheless, the vast majority of people already use these tools. But nearly half of those who responded said that their institution they work in doesn't have a policy on the use around AI. Now, look, this is definitely getting better. Many organizations now do have AI policies, but I think this kind of governance and kind of guidance gap puts researchers in an awkward position where we are already using these technologies, but we don't know what the kind of the rules are about how we should use them. And importantly, there's not necessarily guidance about how to do things well. And that's some of the stuff I'm going to touch on in my talk today. So look, we're going to talk through the opportunities, we're going to acknowledge many of the pitfalls, and then I'm going to finish up by pointing out some, I think, quite useful practical guidance on how we can all use AI safely and effectively for research, recognizing that these are tools. They can be used well, they can also be used badly, and it's down to us as the responsible human in the room to make sensible choices. So look, let's start off with the opportunities. Now, if I had given this talk 2 years ago, I might have had to explain some of this thing, but I anticipate that many people listening in today will already be using AI routinely for their research lives. And so AI is a research tool for things like transcribing interviews, for conducting systematic reviews, for data extraction as part of systematic reviews. These are all kind of, I would say now, pretty standard uses of AI that have emerged over the last kind of 18 months to 2 years. And there's been guidance from the Cochrane collaboration on how to do this well. And then there's also an increasing number of web platforms for systematic review in particular. I'm thinking particularly about Rayan, which is a systematic review screening service, which now has AI embedded, enabling you to rapidly get through systematic reviews much faster than if you were just doing human-led data extraction and human-led screening. AI is obviously a research topic too. Many of us, myself included, are AI researchers. So whilst I personally don't develop any AI, I do work closely with people who do. But importantly, I observe AI, I watch it, and my research is conducted around what AI is doing, how it can be used, how it's being used, both in practice and across research. So we can study the world of AI, we can study the world of AI as applied to healthcare. We can also talk about the ethical considerations around AI. And then there's a whole bunch of studies on basically benchmarking large language models. So putting them through certain tests, asking them certain question banks and seeing how well they perform, or trying to work out which models have most signals towards harm and that sort of thing. So AI can be an entire topic of research by itself. But I put it to you that one of the most exciting ways that we might think about and conceptualize AI as researchers will be AI as a research assistant. So not just as a single tool that we use once, but actually something that we use throughout our day to kind of change how we do our work. So many of the frontier large language models, things like Google Gemini, OpenAI's ChatGPT, Anthropic's Claude, they have these deep research modes or kind of extended thinking modes where the model can go away and deliberate for many, many minutes, maybe as long as half an hour. It can search the web. It can have complex, what's called agentic workflows, where it can pull on certain tools and certain capabilities, can structure its thinking, and then come back with a written report or maybe an audio summary of what it found. This can be really useful if you want to quickly understand a complex area, rather than just having one-on-one messages, kind of back and forth chats. You can kind of set the model thinking, go away and do something else, and come back to review what the model came up with. And that could be really helpful for certain things. I already mentioned audio overviews, so many people might have heard of Notebook LM, which is a product made available by Google. There are also other similar products from the other frontier labs. And both Notebook LM and Google Gemini now can produce audio summaries of content you provide, or maybe audio summaries of what the model generates for you. And that can be really nice. If you have a commute between two office sites, or maybe you're out for a dog walk or something and you want to listen to a summary of what you come up with, you can find different ways to kind of slot large language model generated content into your day to help you maximize yield from this sort of thing. We also have the opportunity to ask these models kind of to explain things straightforwardly to ELI5, explain like I'm five, or to structure a prompt around such a way that you might have a really complicated paper that you want it to kind of give you the bullet points of, to work out if this is something that's actually worth reading in detail or not. So I find that really useful myself, because obviously sometimes it can be quite difficult to get through a dense paper and you don't really know if this is a priority for you to read the whole thing. And then lastly, and I say with a bit of a caveat around idea development, well, we've got to be a bit careful about idea development, because I do fundamentally believe that creativity and ingenuity needs to come from humans. But notwithstanding that, sometimes we're just frazzled, our inboxes are full, we find it difficult to think through complex areas. And starting with a conversation with a large language model can be a really good place to bounce around ideas, almost a bit like a virtual colleague, and see what sticks. I just want to walk you through an example of how I've used a large language model only in the last few days. So I use Anthropic's Claude to help me produce figures. Now, I learned how to code in R during my PhD and the years before then. And what used to take me maybe a day or two to make a really nice figure can now take me maybe 10, 15 minutes, because I have a bank of my own code in the past, which I've uploaded to Claude. And it is just simply R scripts about how I've produced figures in the past, how I've used certain functions, the way I've personally found it easy to transform data from kind of CSV files into long or wide formats. So it kind of knows how I write code. And now I can describe in plain language kind of the figure I want based on the data I have. And Claude will generate very good code, which I can basically take straight into my R environment. So if I just let this video play through, this is me trying to make a figure which maps the number of data sets in a particular systematic review And then this is actually ironically a project about use of large language models in healthcare. And we go through a bit of a back and forth about how we might use certain functions, whether I could use a Sankey diagram rather than a bar chart on the right-hand side to show more information. I think Claude 1 says no, and it produces the first graph. Now, I think this looks a bit ugly. The colors are a bit off, and the bars are a bit too skewed. So I go back and say, well, this is fine. It's just a bit ugly, though. And so it says, oh, yeah, I agree with that. We talk through some of the options, maybe to make it a little bit more kind of organized and a bit less ugly. And Claude produces more code, and this looks a bit nicer, doesn't it? So we've now got a slightly nicer figure. But the crucial thing is that at no point have I had to personally go through and edit lines of code, which would have taken, to be honest, hours. Instead, I have this very short conversation. It tells me where I might need to edit code if I need to do it manually. And then it will output and give you my final set of instructions. So look, this is just one of the ways that I personally use language models. I find them very helpful. Your mileage might vary, and I definitely wouldn't recommend relying purely on them for coding, because they do still make very big mistakes at times. But for shortcutting that process, it can be phenomenally helpful. Another kind of area where AI might have some influence over the way we research. Well, increasingly, we're going to see large language models used as journal editors or as peer reviewers. Now, again, this would have been an anathema 2 years ago, a very unlikely, seemingly dystopian suggestion. But the reality is that many journal editors from the leading medical journals around the world are actively exploring this if they don't already have a pipeline in place. So Nijm AI, the New England Journal of Medicine AI, which publishes a lot of trials and kind of emerging evidence on AI in healthcare. They now have a first pass LLM enabled editorial submission pathway. And I know that other leading journals are doing a similar thing too. This is, I think, quite a useful thing. For those of you that have submitted to leading journals, you'll know that the submission process is often extremely painful, very time consuming, lots of filling in forms, lots of duplicative information. You'll have the authors and their affiliations on the title page of your paper, and you'll have to manually type that all out again on the submission process. Well, this is the kind of thing that large language models are brilliant for. And so it really does kind of make sense to embed that in the submission process. But also for peer review, for fast stat reviews, if you're submitting work which is just not in scope of the journal, or the quality is not good enough, there are significant methodological issues, then rather than wasting editorial and peer review time, you can get a quick rejection and move on to the next process, or maybe get a quick rejection with some suggestions for feedback. So that again could be very useful. And then simple things like reporting guidelines. We've had a proliferation of these over the last few years, and they're fantastically important. You know, the Consort Spirit guidelines, all sorts of guidelines for different kinds of journal articles, Prisma, etc. These help us write better papers, and they help us ensure that we report transparently. And most journals make them mandatory, but can be quite difficult to check that the reporting guideline has been applied properly. And so a journal could automate that. It could basically say that your paper will be assessed against a reporting guideline relevant to the article you're uploading. And if you haven't reported transparently according to that process, then you get an immediate desk reject with guidance to improve. So that again could be quite useful, both for journals and for submitters of work. And then obviously the normal stuff like formatting, typography issues. Those of you that again have submitted to journals, you'll know this is painful back and forth often, where you'll get proofs on a PDF. You might have to make some changes, and you'll get another PDF version 2 with some more changes. Again, if we could just speed up that process by having a large language model do that kind of typesetting bit, that would make things much easier and much faster. So this is definitely coming. Now, just one area of controversy. There have been a lot of people discussing recently on LinkedIn around the increasing numbers of articles that appear to be either wholly generated by AI, or, I think worse, peer review comments, which are also generated by AI. And I do worry myself a little bit about whether we might end up in a place in a few years' time, or maybe sooner, where we have papers generated by AI being submitted to journals who assess them using AI, and that horrible kind of feedback loop that might ensue as a result. I don't think we're there just yet. This is definitely a work in progress in terms of AI-assisted peer review. And then the last thing I'll talk about is AI as a health intervention. Now, look, this is an active area of research for me, but it's not really a topic for this talk. We're not here today to talk about AI as a medical device, AI for use in diagnostics, AI for use in therapeutics. I'm really happy to talk to anyone who would like to discuss these sort of areas offline, but just I guess a placeholder slide to say that very important, very interesting, not in scope for this particular talk today. Okay, so we talked a lot about the opportunities for AI, but now I want to spend a few moments dwelling on some of the pitfalls because I think these are really important and interesting to explore as well. Well, look, there's been a wealth of research over the last decade or longer pointing out the many different ways that AI can go wrong and cause harm to individuals and people within society. Leading work by Ziad Obermeyer and colleagues back in 2019 highlighted the propensity for algorithms to go wrong and to proliferate harmful racial inequalities. In that particular example, an algorithm trained to identify healthcare costs based on trained to identify healthcare needs, so that individuals' need for healthcare assistance based on how much their prior healthcare had cost, obviously disadvantages people who don't have good access to healthcare. And in a system like the US, where you might have insurance or you might not, people who don't have very good insurance their healthcare will be cheaper and they'll appear less sick. But that is not a reliable indicator of how sick they actually were. So these sort of harmful biases can proliferate through models and cause people harm. And that's definitely been a problem when it comes to the world of medical artificial intelligence. And I think it's fair to say that this algorithmic bias, this disadvantage, is being increasingly recognized and increasingly studied. And I put it to you that none of this should really be a surprise because the way that we generate AI is to collect information from the real world that we live in and then feed it into algorithms. And all algorithms are basically complex computer programs which fit the data we feed them to a model, and that model is a reflection of the information we feed them. Now, we can of course code the model incorrectly, and there can be some technical problems with the models themselves, but to some extent that's less likely than just simply modeling data which is biased. If we collect information from a biased society where certain groups have disadvantage, there are echoes of racial oppression, discrimination, there's disadvantage and inequity throughout our society. We bake that into the information we collect, and then we bake that into the algorithms we produce. So to some extent, it's not the algorithm's problem; it's actually a societal problem. And we've done a lot of work, our team at the University of Birmingham, the last few years to really try and unpick the information we have available. And look, a series of systematic reviews we conducted across a range of different disease areas. We highlighted that across mammography, ophthalmology, COVID-19, heart failure, and skin cancer data sets, there's a real underrepresentation of countries, particularly in the global south, with most countries around the world not represented in data sets. So in this top plot here, countries that are coloured in dark green, they have at least one data set for any of those 5 disease areas. And the countries that are kind of shaded in a much lighter grey, they have absolutely no data available at all. And you can see pretty much all of the continent of Africa is just underrepresented in data sets. And this is a big problem because one of the sales pitches for AI at the moment is that it can fill in the gaps in existing healthcare provisioning. The argument would run that in advanced economies like the EU, UK, US, China, etc., access to healthcare is pretty good, and so we're kind of talking about marginal gains from AI. But if you're in rural or sub-Saharan Africa, where access to healthcare can be really patchy, if we can drop a large language model or other form of AI into practice, then you might be able to massively expand healthcare provisioning across people who don't currently have it. And that might hold true, but what we know about AI is that when we have underrepresentation of certain groups, those groups experience worse health outcomes when AI is used, and we can't be ensured that AI will generalize well to groups where they haven't been adequately represented in the health data. And so that gives us some pause for concern about how well these tools might work for certain underserved communities, unless we take active steps to try and mitigate those issues. And there's also loads of other problems we found with data sets, including that really important parameters like how old someone is, their sex, their gender, their race, their ethnicity, socioeconomic status, all these kind of things that interact with our health and our life chances, they're often not reported. And things like consent and ethics and whether people's permission was given for the information to be shared is often not reported in data sets. And all of this is a problem in and of itself. Just an example of kind of how data sets can go wrong. Well, we found numerous examples where there were data sets designed to enable development of an algorithm to diagnose COVID-19. So these are data sets created during the pandemic. And what these data sets were effectively entirely, normal images of children and entirely abnormal images of adults. And so whilst the dataset curators had the intention of making an algorithm that could diagnose COVID-19, what the algorithms were actually doing was diagnosing children. And it's not really a very good use of AI to take a chest X-ray of someone to work out if they're a child or not. You can work that out very easily yourself. But you can see how this might be something, the context of this might not be known to computer scientists. Computer scientists don't know to look at an X-ray image and know how old the patient is. But anyone who's medically trained would be able to eyeball these images and see immediately that that children are on the top row and adults are on the bottom row. Anyway, just some of the context we found and why reporting that metadata is so critically important and why transparency issues in data sets can be so problematic. And this brings us to the notion of the concept of the myth of generalizability, where it can be tempting to assume that machine learning systems, AI generally, will generalize across contexts. I kind of touched on this earlier, that if we produce an algorithm in context A, if we move it to context B, it will still work well. But I think all that we've learned about AI means that we can't assume that hypothesis is true. So those of us as scientists will know that we feel our way through the world by testing hypotheses, building hypotheses and testing them. Well, we shouldn't just assume that AI will work well. We need to test that and ensure that's true. As per this paper here, machine learning systems are not like thermometers. They don't reliably measure the temperature of our universal rules of physics. These systems can go wrong in unpredictable ways across unpredictable contexts, and it's really important that we assure ourselves that they're working well when we choose to use them. And I talked a little bit about hallucinations earlier on. Well, this has come into salience in the last few years with the rapid advent of large language models across most of our lives. But hallucinations are basically, well, they're kind of a feature of large language models. It'd be tempting to think that these are an undesirable and a thing to be engineered out. But to some extent, because of the way that large language models work, the fundamental architecture of the model, there will always be a small risk that it generates something a bit unusual. And these are hallucinations, effectively inaccuracies. You should probably think about these tools as being probability machines. What's the next most likely word or concept following a sequence in the context of language? The models themselves don't mean anything. They don't have any understanding of the world. Any coherence we kind of get is as a result of our interpretation of what the model's output. But the kind of summary that I'm trying to make here is that large language models do hallucinate, and the hallucinations are likely to happen the more you go, the more complex your query, the more complex the task, the longer the context, etc. So just something to bear in mind is that these tools have inevitable inaccuracies in their outputs, and it's important at the moment, at least, for us to always check and to make sure that we are happy to stand by what they generate. And look, there are loads of other risks that, frankly, we don't have time to go into today. Things like the epistemic risk. So what does truth mean in a world where we don't humans generate most content anymore? We instead rely on an internet full of LLM generated text. Until a few years ago, every scientific paper ever written had been written by a human being. But now the scientific record will be full of papers that have either been part written or entirely generated by LLMs. And they won't be in the best journals. They're going to be in the open access, sometimes predatory journals. They might be on blogs, and the models that we use will be trained on the entire internet, including those papers. So we're going to get this echo chamber effect where I have an LLM generated text which feeds into the future training of another LLM, and so ideas will proliferate around. And there's one kind of theory that we'll get to an information maximal point where there is no new information in the system, and all we're getting is reverberations of conversations between LLMs at different points in time. I touched earlier on about the point around plagiarism, academic integrity. Where do we draw the line? These tools are available, people are using them. It would be, I think, a bit silly, reductive, and probably, you could argue, irresponsible to say to students, don't use them, because they will. And moreover, in their real jobs, when they start work, whatever their job is going to be in the future, there will be an expectation that they use these tools well. So I think our job as educators and as academics is to draw the line carefully and to give clear guidance and instruction to say what we absolutely must not use LLMs for, but also to give clear instructions and clear guidance on how to use them well, and recognise that they can be really powerful tools to improve the world too. I know that some universities in the UK are providing institutional access to certain LLMs. I think some of the London universities now provide access to Claude for all students. Some universities are much more restrictive and say that they consider all use of LLMs to be plagiarism. I think that latter position is quite tricky to justify, particularly as we move forward into the brave new world where everyone will be using these tools most days. I want to introduce the concept of cognitive debt, which I think is quite interesting. Now, look, I don't want to oversell this particular paper. There were some really, really dramatic headlines across the media, things like, your brain rots on ChatGPT, etc. I don't think that's quite what these articles show. But anyway, a team of MIT researchers, I think about 18 months or so ago now, did a nice little study where they had three groups of students. One group who wrote an essay just using their own brains and no external guidance, one who were able to use Google search, and then one where they were able to use a large language model. And they tested things like recall of their work, the quality of writing, and also they put their students through functional MRI scanners and basically looked at kind of brain activation in certain areas. And what they found was that there was less kind of critical engagement in the learning process from students that had used LLMs compared to Google, compared to their own brains. They were less able to recall what they'd written about, and the quality of writing was a bit more generic and vague. I think that maybe the grammar was slightly less accurate in the kind of human written articles, but there was more flair and kind of interesting. So I think that tells us something quite interesting, that LLMs will tend to produce quite boring but quite predictable and quite good outputs, but real brilliance comes from humans trying really hard, and that we can't shortcut that learning process. If we need to generate a quick report for a deadline tomorrow, then we can do that quickly with an LLM for sure, but we don't learn anything in that process. And I heard one person talk about it on the radio recently. It's a bit like having fast food for dinner. Like it will fill you up right now, but it's not necessarily good for you in the long term. I think it's recognizing when the right thing to do is to move quickly and when the right thing to do is to struggle and learn and develop yourself as a result. And look, there were loads of other problems that we don't really have time to get into today. Things like the interaction between large language models and intellectual property, the fact that they basically gobbled up the entire internet, including stuff that is probably copyright protected. It's unclear at the moment as to what the law is on that one. Data security information leak, you probably should assume that pretty much everything you put into an LLM will theoretically be extractable by someone else. So, sharing confidential information that you don't have permission to share is probably not ideal. But also just being mindful that, if you're, let's say, writing a grant proposal and including information that you consider to be a bit sensitive, then theoretically that could be leaked on the internet to other people. Many of the most advanced LLMs have usage limits, and or they are locked behind paywalls. Now, look, $20 a month isn't very much, but no one should kid themselves into thinking that $20 a month is anywhere near enough money to be paying for these tools. The companies are making a massive loss giving you access to frontier models at that price point. To really get the most from these models, we're talking about API access, and we're talking about hundreds, if not thousands, of dollars a month in terms of real use, and not everyone can afford that, to be honest. Then there's the issues of data and technology colonialism, where many of the world's leading AI companies are based in Silicon Valley in the west coast of the US. Yes, a few open source models from other parts of the world, but in terms of usage, the vast majority of models are based in that small area. What does that say about kind of our society, that we have such a massive proliferation of wealth and power within that small area? And also, what's about the risk of LLM owners, the companies that kind of own them, or the individuals that are powerful there, turning on a sixpence and changing their mind about what the LLM should do, either withdrawing it from market, forcing the LLM or coercing it to follow their particular political interest, or manipulating its outputs in some way. There's obviously the risk of commercial interest. We're starting to see commercialization of LLMs, where companies are generating content which is ready for LLM consumption. So you might have a company trying to make their website really scannable for a large language model, so it comes to the very top of the results, or increasingly we might see paid adverts within LLM outputs. And what does that mean in terms of the quality of information we get back, if companies are able to pay to be higher up in the kind of the output? Now, look, this is kind of all coming to a bit of a head, really. What can we do, recognizing that these tools are very powerful, yes, but there are lots of problems as well. Like, how can we make the most of these tools in a safe and responsible way? Well, I think some clear messages for me. The clearest message from me is that there's real risk of delegating our thinking too early. And I think it's really important that we recognize these tools are very helpful. But again, going back to that fast food analogy, going fast is not always good, because sometimes you learn by being up all night and thinking really hard and making loads of mistakes and turning in something that's half baked and getting some feedback from your professor, and then submitting something that's brilliant afterwards. And sometimes that process can take years, or months or years, and bypassing that by generating something with an LLM will get you to that outcome, but it won't educate you as a person, so you get no better. And worse, there is some evidence that people who rely on large language models might never achieve the kind of the career state or the education state they might have got to otherwise. I think it's also really important to try different tools. They're updated on a staggeringly frequent basis, and there are lots of new capabilities all the time. Many people will use ChatGPT. It's by far and away the most popular and most common one, but the other models have other benefits too. And particularly as many of them have free versions, there's almost nothing to lose from giving them all a try and just seeing which one fits best with the workflows you have. But one other message is to be really aware of confirmation bias. This is a concept now of sycophancy. Models are, because the, because the manufacturers want to optimize for kind of conversation, there will be a tendency that they will be very agreeable. And the better models have got over the last few years, the more kind of agreeable they've got with you. So there is a real risk of kind of echo chamber effects where models learn what you like and they serve you content which matches your worldview. And as scientists, we need to be really careful about that because science operates in a place where we should be very challenging to each other and we shouldn't assume things. We need to make sure that our points are rebuttable and be absolutely sure that what we're saying is evidence-based. And there is a bit of a risk that models will worsen confirmation bias and make us think that we're always right. So I think being mindful of that, and in particular being mindful of the fact that models will tend to learn what we like over time. They're not just a fixed point. That many of the models have this thing called memory, where they can kind of learn how you write, how you speak, and that memory is to some extent it's useful, but it can be a problem because it can kind of tune the model a bit too much to respond to you as an individual. Another key message, I guess, is to follow guidance when it's available. Now, I mentioned that many institutions now do have guidance on the use of LLMs. Funders, for instance, I've seen many funders across the UK in particular now have statements in the information for applicants about how they can and should use AI, including whether they should acknowledge that. Often, a little while ago, places were asking you to give like the prompt you use. I think that can be a bit unhelpful because, well, often you might refine prompts multiple times, or you might have quite long conversations with an LLM over many, many weeks or months. So I think saving all those prompts is probably a bit unreasonable. But general broad brush kind of functions of the LLM. Have you used it for idea generation? Have you used it for idea refinement? Have you used it for generating the text? Have you used it for copy editing the text? Those sort of things. I said higher educational institutions have different policies. I mentioned that some do consider Gen AI to be plagiarism. I think that's harder and harder to justify as a position, but it is nonetheless the position of some places. And look, if you're a employee or a student at one of those institutions, you have to go with your organizational policy. But I don't think you have to sit back and accept it. I think you can advocate for that policy changing. And I think probably we're going to see more and more organizations move to a different place on this sort of thing over the next few weeks and months. Professional bodies will, the RCGP, the Faculty of Intensive Care Medicine, the Royal College of Radiologists, and many others have guidance on the use of generative AI for both professional and also for clinical purposes. So it's worth looking at those. And I mentioned as well about journals. Well, many journals now have submission guidelines that ask for transparency about when large language models are used and how they're used. So I think being aware of the need to provide that information at journal submission is going to be really important too. Oh, look, so I'm gonna wrap up there. I think I've talked for about half an hour, and that's probably enough in one go from me. I think again, just reflecting on those takeaways, that AI is a tool. All AI systems are tools, and they can be used well or they can be misused. And if they use well, if we can learn how to use particularly large language models as researchers, I truly believe they can be transformative. I'm no longer spending weeks refining my lovely ggplots. I'm spending half a day max and moving on to the next task, and that's a good use of my time. But recognizing that we all have different educational pathways, and sometimes struggling and refining your ideas is the right thing to do rather than shortcutting the process with a large language model. And that we're going to get more and more guidance to help us as researchers to make the best use of these technologies. But I think it's also incumbent on us as researchers to signal to those who employ us and those who lead us as to how we can best use these tools. The half-life for information and for knowledge about AI at the moment is weeks to months. If you're not an expert right now, that doesn't mean you can't be an expert in the near future because the world is moving so fast. Equally, people who were experts 2 years ago might not be experts anymore just because of the sheer pace of change of this world. So all of us can upskill, all of us can educate ourselves, and all of us can advocate to move to a place where we have sensible, robust guidance to ensure that we use these tools well, safely, and effectively, and get the most out of them as research partners. So that's enough from me. I will stop sharing my slides and really happy to take any questions.
Thanks so much, Joe, for a brilliant talk, as always. And you've provided some really useful practical guidance for viewers. I just had, so one of the questions I wanted to ask you was, our main concern with AI, as you've mentioned, there's various pitfalls and risks with it. It looks like you're one of the lead researchers on the Standing Together initiative. I wondered if you could sort of explain to viewers what this is and what it aims to do.
Yeah, thanks, Louise. That's a good question. So, look, you mentioned Stand Together. Now, I touched on it briefly in my talk around the issue of data bias, but let me kind of unwind that message a little bit more. Back in like the early 2020s, there's increasing recognition that algorithms, particularly those used for medical purposes and direct patient care, could show bias, and that this was particularly common for groups who are underserved in society or those who already experience worse health outcomes. And a bit of kind of heuristics under the hood kind of worked out that there are many ways that we can introduce bias, and that can be through the way we make models, it can be through the way we prioritize health conditions for funding for research, but it can also be because of the data we feed into them. I'm just thinking back to that slide I presented around our systematic review of data sets. What we and others have shown is that data sets internationally are often quite unbalanced, with broad representation for those who have advantage and certain countries completely missed out. Now, that in and of itself is a problem, because obviously we'd want representation in data sets for as many people as possible. Obviously, not every data set needs to be perfectly representative, because if you're producing an algorithm for use in the UK, then probably it's most important you have UK data rather than data from China or Australia, etc. But I don't think we can defend a position where half the world is underrepresented. But that notwithstanding, to some extent, imbalance in data sets can be fine because it can be really hard to collect data. But what's definitely not fine is not knowing about that imbalance. So that transparency gap. If we have a data set where certain people have been excluded, but they really should be in it, and they've been excluded because of barriers to accessing healthcare or just inefficiencies of getting information through. Well, we as developers really need to know that information, because if I'm making an algorithm based on that data, I need to know who was represented, how they were represented, any errors, omissions, gaps, etc. So I can understand the nature of that, understand the implications, and then develop my evaluation strategy to test a hypothesis that those groups might not have good outcomes when the algorithm's used. So Standing Together was trying to basically unpick all of that. We're trying to say, look, there's a real transparency issue here. We need data sets to be documented better. So we need clear information about who's in them, who's been excluded, why. Technical information and metadata, stuff like, if you're making images available, what was the type of scanner you use? If it's a CT machine, what were the settings for acquisition, that sort of stuff. But also more kind of step back societal stuff like, did you ask for ethical permission to share this information? Have patients consented? All that sort of thing. And then on the other side, Standing Together is also about helping people who make algorithms make good choices. So thinking through which groups are at risk of harm in your particular disease area. If you're developing a skin cancer detection algorithm, let's say melanoma, for instance, it's a really complex disease area where it's far more common if you have paler skin. But if you are someone who has darker skin with melanoma, you're much more likely to die from it. So what condition are you optimizing for? Are you optimizing for detection, or are you optimizing for mortality prevention? Because those are completely different use cases. So really understanding the clinical area and then collecting information, collecting data sets really that match the need you're trying to solve. So Standing Together was a big international collaboration to try and do that through a set of recommendations, for want of better words. We've published an extremely long and in some places quite tedious paper. But if anyone's interested, I can drop a link in the chat. And it's available open access on the Lancet Digital Health and through Nijm AI.
Thanks, Joe. And I encourage any questions if anyone wants to write them on the webinar chat, and then I can read them out to Joe. You said that you mentioned before we started the webinar that you've got something new that you're excited to share with everyone.
Yeah, well, I guess I can give a bit of a sneak preview of this one. So again, back on the subject of large language models, many of us will be aware that these tools are really helpful for a lot of parts of our life, not just research, but also for direct care, direct health. And there's been a series of surveys and polls the last few years showing that increasing number of health professionals are using large language models, things like ChatGPT, Google Gemini, Anthropic's Claude, etc., for clinical purposes. Now, there can be some problems here around, information leak. If we put personal patient information into these models, that's obviously completely indefensible. But asking really broad brush questions, how could I manage, eczema that's not responding to topical steroids, something like that. That's not sharing personal information from patients. And arguably, it's no better or no worse than Google searching it and finding, maybe a slightly dubious quality blog. So many people are using LLMs for that sort of purpose. But what's been an increasing trend the last few years has been patients using LLMs for that sort of purpose. Now, I think this is both really exciting and really terrifying because um, those of us that are old enough to remember kind of the fear around Google searches and when Wikipedia wasn't considered a trustworthy source, the information on the internet's got a lot better in the last few years. There are some really good resources now. And so if someone does Google search, let's say they're unlucky enough to have a new diagnosis of diabetes, well, they'll get some really good guidance from a Google search. But is that the same from a large language model? Do large language models give good guidance when people search queries? Well, I think, again, there have been lots of articles showing that they can do. Many of the models are really good. They give really good quality information. But the quality of information is often quite, it can be a bit random. Sometimes the models don't give good quality information. Sometimes they give actually harmful information. And in many cases, it's down to the nature of the search and what was asked for. I don't think patients and the public necessarily understand that when they're querying a large language model for health advice, they're basically taking all of those middle steps of safety out of the health system. So if they go and see their GP or another health professional and ask a medical question, maybe they get prescribed a medication and then they take it and they go to a hospital appointment and get some scan or something. Well, every stage of that process has been regulated and governed. So the medical professionals they speak to, they're all personally regulated. They've all been through some sort of educational process and been signed off. There's revalidation to make sure that they're not being charlatans and practicing badly. The medication they were prescribed will have been dispensed by a pharmacist who's qualified. It will have been manufactured according to international regulations and international standards around kind of pharmaceutical regulations. The hospital information system that keeps all their information will be secured according to certain ISO standards and data protection laws. Basically, every single part of that pathway has some sort of governance within it. But if I type the same query into ChatGPT, then there's almost nothing that governs OpenAI to give me a good response. There's a bit of discussion at the moment about whether and how existing regulations could and should apply to those models, but that discussion is moving far too slowly and the conversation is moving far faster for patients. And so we put together this international collaboration to build a health chatbot user guide. And if I just quickly share screen just to walk you through this project. So the health chatbot user guide is basically advocating for advice for the public on how to use these tools well, and some of the pitfalls they need to be aware of to avoid harm. And so, we talk about our governance blind spot where there are risks and opportunities, but as I described before, many people I don't think understand that they're taking on this kind of risk mitigation themselves. And really importantly for this project, we're taking a neutral stance. So we're not telling people they should or they shouldn't use these tools. We're just saying you are, and how can we do this in a way which is as safe and effective as possible? And we want our guide to be easy to use for the public and in an accessible format so that we're not describing really complex technical things. We're instead discussing and describing things really straightforwardly. In terms of what we're doing, well, we're going through kind of 4 scientific steps, and anyone who's done qualitative mixed methods research will recognize this pathway here. So we're starting off with a review, a rapid review of the evidence, moving into a series of public workshops and patient-public involvement discussions to understand kind of how people use certain tools. We're also conducting a scoping survey to ask experts internationally about kind of what they're worried about, using what's called a Delphi study, which is a prioritization and consensus finding activity to basically come up with a long list of things that we think are priorities to communicate, and then signing that off. And then building the guide, which will effectively have a small number of red lines. So things that we think people should be really aware of and probably should avoid doing, like entering personal information, using chatbots in a medical emergency, asking for medication calculations, because we know that some LLMs will sometimes struggle with mathematics, but also a list of things you could consider. So here are some ways you might find chatbots very useful. Anyway, I won't share any more about it there, apart from I'll put up a link in the chat. And if anyone is interested in that particular project, I'm really happy to to take on collaborators to help with our Delphi panel or to basically input guidance across that lifetime of the project. And just to flag in terms of timeframes, I think this was needed 6 months ago. Now is too late, and in 2 years' time will be hopelessly late. So we're moving really fast. We're hoping to get something out on this front by the summer.
Thanks, Joe. It looks a brilliant initiative. So it seems surprising that there's still not really any clear rules and regulations for using these technologies. Did you say it's in the process of that? Are the government in the process of writing these? Do you know?
Yeah, so I mean, one other thing I can share is that the MHRA, the UK's medical device regulator, the Medicines and Healthcare Products Regulatory Agency, currently has a national commission into the regulation of AI in healthcare. And look, this is an opportunity for the UK to create a new or different framework for regulating AI. Now, I said there's a problem of scope and a problem of kind of regulatory content here. So there is discussion about whether a general purpose tool like ChatGPT would even fall within the scope of regulations. You know, if I put a query in ChatGPT about a recipe or a holiday to Italy or whatever, it will give me an answer. Equally, I can ask about my eczema. But the tool is not necessarily intended to be used for that medical purpose. It just can be. And so some people would argue that it's not in scope of regulation because that's not what it was intended for. Others would argue the opposite. These discussions are happening, and I think we'll have a more clarity and probably a more up-to-date stance in the near future. But as I said, the world's moving incredibly fast now, and regulation is something which will always be slow and time-consuming because it's really important to get right. I think guidance can move much faster, and I'm particularly interested and excited about the idea of working directly with the public to produce guidance for the public, because I think that's the way we get the best, most useful information out there.
Do you know if sort of training in AI is that becoming the mainstay part of the curriculum yet in schools and undergrads and postgrads?
It's a good question. I don't know. I hope it is. Look, we can be tempted to think that we need to put more education in. I think those of us that are millennials and younger will be digital natives. We'll have always used the internet. We kind of know what it is. We don't need training on the internet because we use it. What we need training on is information governance, data protection, that sort of thing. So I don't think that's any different. I think to some extent AI is the same and different. We still need to have the same founding understanding of statistics, of data protection, information governance, etc. And that also applies to AI too. I'm not sure that everyone needs to be an AI technical expert. Most people don't know how coding works, and that's absolutely fine. I think, though, anyone who uses a AI system as part of their job needs to understand how it works and how it can go wrong. That's just good practice for anyone using any technology, including hardware technologies and software. What I do know is that medical schools are starting to put AI education into the curriculum. I think that's right, but obviously there's the discussion around proportionality, and given that the curriculums are already overburdened with all the stuff that medics, surgeons, anaesthetists, emergency physicians, GPs already need to know, what is it we take out of the curriculum? Because we've already got a lot in there, and if we're putting more content in, more content of quite a technical nature, then something else will have to come out.
It seems like sort of hallucinations for the questions we might ask about health-related things is probably, to me, one of the scariest things that could happen if a patient in particular is asking for information. Do you think there should be sort of, I suppose, a lower threshold for the system to go, I'm sorry, I don't have enough information to be able to give you an answer to that? Do you know what threshold are they? Are they all set differently for the different systems?
So I think one of the challenges here is that the technology is moving so and improving so rapidly. We talk about a jagged frontier of capability where certain use cases for large language models in particular are very advanced. They're brilliant at certain things already, and in some areas they're not very good right now. So it's kind of jagged graph, if you will. But I think it's fair to say that the frontier is moving very fast. So things that models are currently bad at, they're getting better at. Things that models were hopelessly bad at a year or two ago, then they can now do perfectly fine. So it's very challenging to answer that question robustly, because you'd have to know which model of which version at which time point and for what purpose. But I think in general, things like hallucination rates are right down. They're getting better and better as we move forwards. There's often a trade-off. So if you optimize models for fluency, you might get more hallucinations. So a model which says I'm not sure will probably hallucinate less. But sometimes users don't want the I'm not sure answer. Sometimes users want an answer. And if you push a model, it will give you one. But that's where the nature of the prompting comes. If you make it absolutely clear you want evidence-based guidance only, then it's much more likely, probably, I'd expect, to give you fewer hallucinations, but not for certain. But I think every single frontier manufacturer is trying to solve these problems, and with near limitless resources, I'm confident we'll get to a place where they're much better than they are now. Whether we can ever get them to a perfect place is uncertain, but the provocation I'd give back is that we know that humans get things wrong all the time. The medical error is one of the leading causes of death internationally, isn't it? And you know, most of us will have experience if we work in hospitals of mopping up a mistake that happened somewhere else, whether that was a mishearing, a miscalculation, a simple mistake. So it's not like humans are perfect. In fact, we're very much not. So the hallucination rate of model might be down here somewhere. Hallucination rate of humans might be up here somewhere. And what do we do in that world?
Well, thank you, Joe. I don't think we've got any questions at the moment, but really thank you so much for your brilliant talk. It's an exciting time to be in AI, and I look forward to seeing the work that you do.
Thanks, Louise. It's been great to talk to you.